Medicare becomes your primary coverage when you separate from service. If you're age 65 and you're still employed, you are not required to sign up for Medicare. You are not. But when you retire, you basically have what they call 7 months to sign up for Medicare, or you're going to pay a penalty for that. Medicare will again become your primary coverage. If you have Medicare and the federal employee health benefit coverage, the federal employee health benefit coverage becomes your secondary coverage, but Medicare is your primary coverage. And Medicare Part A is going to pay for your hospital stay, right? Now, when you are discharged from the hospital, any of those facilities, when you're discharged, any follow-up cares that are to follow, it's not going to pay for that. That's where Medicare Part B would come in. You would have to select Medicare Part B, right, which is optional. Now, it's optional, but if you have Tricare, it's not optional. Because those of you who retire from your branch of service, Tricare should be your healthcare of choice. It's really inexpensive, but it's great coverage, right? Great coverage. And we have a group of Medicare specialists that helps everyone navigate through the healthcare puzzle, right? So you're not, not having the coverages that you need or having coverages that you do not need. But Medicare Part B will help pay for your outpatient care, your annual physicals, right? The follow-up care, things that are not covered under Part A. But again, if you have Tricare, you must sign up for Medicare Part B. The other caveat to Tricare is when you reach 65, if you're still working, you still have to sign up for Medicare. That's the difference between Tricare and the federal employee health benefit program. So you do not have to sign up for Medicare at 65 if you are under the federal employee health benefit coverage. Okay? Then you have Medicare Part C, which is Medicare Advantage, which is equivalent to your PPOs, HMOs, etc. It's an alternative care solution, but it's supposed to be the most cost-effective or cost-efficient medical care because it's a group of physicians working collectively to try and keep the cost of health care at a minimum, right? If you go outside of the network, it may not cover you. But if you stay within the network, you will be covered. You will have to receive a referral to the specialist, just like any other HMO, right? So there's a chance you probably going to have to receive a referral. But some of the PPO plans you may not, have to type of plans. But in most cases, you may have to receive a referral. But if you stay within the network, again, it's going to cover the majority of that cost. Then you have the prescription drug, which is Part D. Part D is to help you reduce the cost of prescription drugs, which we know in this country is skyrocketing, right? Year after year after year. Now, you can visit Medicare.gov to learn more about the Medicare health plans that are available. And also there are a number of Medicare specialists to assist you navigate through those murky waters of gaining better understanding and clarity of Medicare and its coverages.